heard the statistics. More and more Americans are overweight than at any time in history. In fact, we are living through an epidemic of overweight individuals, and that includes children as well. But there is hope, because more Americans are now electing to have surgery to help them lose weight, and it's working. We're talking about bariatric surgery. It's one of the fastest growing forms of surgical procedures being performed by doctors nationwide. Here in the Dallas area, Dr. Colleen Kennedy is a specialist in bariatric surgery. She performs all three of the major procedures, that is, the lap band, the gastric sleeve, and the gastric bypass. And to learn more about these procedures and what makes them so effective at helping people lose weight, we visited with Dr. Kennedy in her Dallas office. Doctor, explain to me what happens when someone initially comes into this office. What do you do?
When someone first comes in, we sit down and we talk. We talk about what they're looking for, and we talk about their medical history. And we find out what their goals are and what they are hoping to accomplish with weight loss and with surgery.
I had reached a point where I just felt like I really had no other options. I wanted to explore what else was out there. I've always dieted, tried different things. I'd lose a little, but then gain twice as much back. I came and I wanted to learn as much as I could. I picked the gastric sleeve procedure because whenever we started talking about the risks and the complications, it seemed to have less risk but offer more return than the lap band and also gastric bypass. What appealed to me was that the sleeve was right kind of in the middle. It had a fair amount of risk. It wasn't a huge amount, but it also had a good amount of weight loss where you'd be able to actually see those results quickly.
The weight loss is different with the three operations. The average weight loss that is seen for the lap band is a pound or two a week, 50 to 75 pounds a year. People lose on average 50% of their excess body weight, which is what we look at. For instance, I am 5'8", so I am supposed to weigh about 150 pounds. So if I weighed 250 pounds, I'd be looking at 100 pounds of extra weight. If I had the lap band, if I was an average person, now some people do better and some people do worse, I would lose 50 pounds, and it would take me up to 2 years to do it. The sleeve, the average person loses 60 to 70% of their excess body weight, and they do lose it in the first year. In the gastric bypass, the average person loses 70 to 80% of their excess body weight, and they do it in the first year. Now, when you look at the long-term numbers for the gastric bypass, people will regain 10 to 15% of the weight they lost as time goes on. So they usually end up maintaining 50 to 60% of their excess body weight off.
Explain the different kinds of procedures that are actually available to help people lose weight.
The lap band is a silastic, which is a fancy plastic band that is placed around the top of your stomach. There are a couple on the market, both the Realize band and the lap band. You see there is a ring that is placed around the top of the stomach. This ring is made of soft plastic with a balloon that is attached with a tubing to a port, which is placed on your muscles under your skin and your abdominal wall. The purpose of the lap band is to control your appetite. By this small stomach above the band gets filled with food, and when this gets filled, it distends and it turns off the hormone that says you're hungry. So you eat a small amount of food, this fills up, you feel full, your brain says you're not hungry anymore, and so you stop eating. It's a nice way of controlling your portions. The advantage of the lap band and why people like it is the least invasive of the procedures out there. It controls portions only. It works very well for people who are what I call food eaters, meaning they can pick the right foods, but they're hungry. And so this helps them to control their hunger and their portions. In turn, they lose weight. It's nice because you don't have to change absorption, you don't have to change your anatomy, you don't lose any part of your stomach. So that's an advantage to it. It is 100% reversible, which is a definite appeal for some patients. As you lose weight, you also lose weight around your stomach, and the band will loosen up some. And so you may need periodic adjustments.
A lot of people looked at me and said, "You're not 226." when they looked at me. I didn't look 226 pounds, but I felt, I don't know, I hid my weight very well, I should say. It was actually the diabetes. I just wanted to be off medication. I was tired of taking medicine every day. And what sparked me with Dr. Kennedy was she had worked at Ochsner Hospital in Louisiana, in New Orleans, where I'm originally from. I just wanted that connection. I knew we would have a connection when I saw her background and her education. And so I looked her up, made an appointment, and when I came to meet her, she made me feel so at home, at ease, and said she'll hold my hand through the whole procedure, and basically she did. I picked gastric bypass because I wanted a permanent fix. I didn't want a temporary fix or anything that was reversible. I wanted something that would not cause me to have the diabetes again.
We actually discuss their individual situation. Each of the procedures has advantages and also depends on what medical problems they have. And also we discuss their eating habits. The gastric bypass is done quite frequently. It is different in that, unlike the band, the gastric bypass has some changes in your anatomy. The gastric bypass, as you can see here, we make a small stomach and divide it away from the rest of your stomach, and then we reroute your intestines. What this does is it prevents them from eating much food, and they don't absorb everything they do eat. The advantages to the gastric bypass is it has an immediate and quite impressive effect on diabetes. Patients will come in on quite impressive doses of insulin and multiple pills for their diabetes, and they'll drop to no insulin, maybe 1 pill a day, or cut from 100 units of insulin twice a day down to 10 units of insulin. The diabetic control after the gastric bypass is impressive, and it's about 80 to 85% of people with diabetes will have either resolution or significant improvement. Reflux is fixed by the gastric bypass 98% of the time. And so if you have severe reflux, the gastric bypass is the treatment of choice. This is a much bigger surgery than the lap band because this is not reversible. This also has some malabsorption component to it. So we are very particular about watching your vitamins that you take and making sure you eat the proper foods to keep your nutrition going. This operation has been around since the 60s. So we have the most long-term results with it. We do know that people who have this maintain at least 50% of their excess body weight, which is how we measure it, for 20 years out. So this is a long-term solution.
Tell me something. I'm sure it has changed your life, but how? How has it changed you?
I've lost over 60 pounds. I feel great. I went from a size 20, 22 dress, pants, to a size 10 now. I'm a 10. I'm comfortable where I'm at. I want it to be a 10. I don't want to be the size I used to be, which was a 0-3. I don't want to be that small. I have 3 kids. I found myself, with my weight, I hid myself away from cameras a lot, taking pictures. I wouldn't even take pictures because I felt and I looked heavier than I've ever felt before in my life. So now that I've lost all this weight, I feel great about it. I look at things in a more positive way, about health, about life in general.
For the sleeve, what we actually do is we resect 3/4 of the stomach. And so there's a long staple line, and your stomach is shaped like a banana, and you resect the rest of the stomach. The advantages to this is the area that actually controls your hunger is right here. And the hunger center, where the hormonal control of hunger is, now gone. So after the sleeve, you can't eat very much and you're not hungry. Taking away hunger is a wonderful thing for somebody who's trying to lose weight. The nice things about this, there's no malabsorption in this, so people like it because they don't have to worry as much about making sure exactly every vitamin they're taking, though we are still very vigilant about making them take vitamins and checking their levels. They also like the fact that there's not a lot of rerouting and changing of things, so food is absorbed the same way it always was. This is absolutely not reversible. Once we take the stomach off and send it to the pathologist, they're not going to give it back. It has a similar effect on diabetes that the gastric bypass has. There's about an 80% cure rate on diabetes with people who've had the sleeve at about 6 months. It's not exactly immediately after surgery like the bypass, but within 6 months they're having the same effect.
For someone who'd never had surgery before, I really didn't know what to expect, and I had no complications. The biggest thing for me was just getting an IV started. That was the most difficult part of the whole thing. And I was able to start losing weight. I started exercising. I started feeling better about myself, and really I started seeing the person in the mirror that I thought that I was before the surgery. So I've lost 83. I am 9 pounds from being under 200 pounds. I feel fantastic. I mean, I still think I have a long ways to go, but in 4 months I've come so far and I feel so wonderful. Every day, you know, getting up out of bed, getting dressed, I feel confident in my clothes, I feel confident at work, I feel happy, I'm not out of breath, I can exercise without having any pain, and I get this, I actually enjoy exercising now. So it's fun to work towards a reward and actually be able to see the results in the process. I'm a very happy person, very, very happy. Happy with the decision I made and happy that I was able to get here and be open to learning more about surgery and the different options that were out there, and I'm happy that I chose this. I would do it again.
To qualify for weight loss surgery, you need to have a BMI, which is a relationship of height to weight, of at least 40 if you don't have associated medical problems, which is about 100 pounds overweight, or a BMI of 35 with associated medical problems such as diabetes or heart disease or severe back problems or hypertension. It helps them get off medicines, it helps them breathe, it helps them control their hypertension, their diabetes, their arthritis gets better because your knees are happier when you lose 100 pounds. I have people who we do surgery so they can get a liver transplant because they're too heavy to get a transplant unless they lose some weight. I've had people do this so they can get a kidney transplant, so it saves their lives. We go through their options. People will come in with a preconceived notion of what they want, and we discuss each procedure, their medical options, the risks, what their insurance may or may not cover, and then make a joint decision.
One gets the impression, Dr. Kennedy, that you really do like your job a lot.
I like bariatrics because it allows me to change people's lives. It allows me to give someone the ability to walk without getting short of breath, let somebody run around and chase their children or their grandchildren. It gives them a chance to have a life again. It's a happy, happy specialty.
A unique look at the various surgical procedures that Dr. Colleen Kennedy is performing on overweight people to help them lose weight, and perhaps even more importantly, keep it off for good. I'm Doug Llewellyn reporting from Dallas.